In this video, we're going to go through microexpressions. Microexpressions are very important in understanding people's emotions overall. Helps you to delve deeper into conversations, understand other people's reasoning, and to be better able to persuade in the situations that need be.
At the Dental MVP, we are obsessed with giving you easy tips and tricks for you, the dental professionals. Subscribe to our channel and don't forget to hit the bell so you never miss out. Microexpressions are quick, less than 20 millisecond facial expressions that happen on a thought or emotion, and you can't fake these.
Researcher Paul Eckerman traveled the world studying emotions. He went to some of the most isolated areas that really had minimal external interference. He found that in reaction to emotions, we all exhibit these universal microexpressions.
Even in children who are born blind, they exhibited the same microexpressions that you and I have, which showed that these are not a taught behavior. In further research, they found over 10,000 microexpressions that exist on the human faces. In this video, we're going to go over the most common 7.
Those 7 are anger, contempt, surprise, sadness, happiness, disgust, and fear.
Anger is when you see the eyebrows pulled down. This usually shows 2 vertical lines between the eyebrows, and the lips are tightly pursed together, creating a hard line.
A great example of when you may see the anger microexpression in the practice would be, say the doctor says, "Hey, Susie, would you mind working through lunch today? There is a limited exam that we really want to be able to see." And her reaction? If you see that microexpression, it's important to recognize that she may tell you yes, but realistically, she's conveying that it's something that angers her and it's not something that she wants to do. You can tell that you're seeing the microexpression of fear when you see more of the whites of the eyes. You'll also see the eyebrows raise, and the mouth is either going to be ready to scream or to take a deep breath. This really shows the flight or fight response, whether they need to take a deep breath or they're going to need to scream.
We see fear all the time. What about when you tell the patient the treatment needs that they have? A quick microexpression after telling someone they need a crown could be, "That's fear." Make sure to pick up on those microexpressions when you're having the conversation so that you know how this individual is feeling before you continue the conversation. Happiness is a smile, and smiles are actually hard to fake. Only 1 in 10 people can fake a real smile. If you want to know what a real smile looks like, look for wrinkles around the eye. What's going to happen is the upper cheek muscles are going to fully raise enough to wrinkle the corners of the eye. That is a real smile.
In dentistry, we all live for this genuine smile. Imagine the patient that comes in that hasn't been able to smile for years, and you finally do that crown delivery and you just see their face light up when they see what they look like. This is something that they've been holding back on and they haven't had that confidence, and you really get to see that warmth in the delivery when you see those crow's feet pop out because you can tell they're just so happy.
Also be careful for the fake smiles, right? If you do a full anterior case and you say, "What do you think?" They go, "It's great." That's a fake smile. Make sure that those cheeks go up high and you see the crow's feet so that you know that they're truly happy.
Next is surprise. So when someone is surprised and kind of caught off guard, what you'll see is their mouth is going to drop open a little bit. Their eyebrows are going to raise up and become rounded. This microexpression can be difficult to tell the difference between fear and surprise. The big key indicator is going to be the shape of the eyebrows. So with fear, your eyebrows are going to go flat, and with surprise, your eyebrows will round. Surprise is a microexpression that can be used in lie detection. So if you ask a question and someone is surprised, then they didn't know. But if that microexpression isn't there, it may mean that they had an idea before you mentioned it.
The next microexpression we're going to go over is sadness. Sadness is the hardest to fake. And if you are seeing the microexpression sadness, it is almost always true. The corners of the lips will curl down, the lower lip might even pout out a little bit, and the eyebrows are going to come down and pinch together. Sadness is an important microexpression to acknowledge. A lot of times when people are sad, they're not going to outright say it. And whether it's our patients or our colleagues, if we see the microexpression of sadness, that means that maybe we've crossed a line and we should acknowledge it right away and have a conversation with them.
The micro expression disgust is probably one that you're really familiar with. When you smell something that's just not appealing at all, your nose tends to scrunch up, your lip moves upwards as well, nostrils flare, and those upper teeth show.
This one we see all the time in the dental practice, and it's hard. We can't fake it or control it. So I'm sure our faces show it all the time. You know, a patient opens their mouth and they have stinky breath. Yeah, disgust.
It's a good thing we get to wear masks. It hides that.
That's true.
Now, the nastiest of all of the microexpressions is contempt. What you see in the contempt microexpression is kind of like a halfway smirk. So one side of the mouth will raise up. We've saved contempt for last because it really is a serious one. Contempt is the feeling that someone is beneath you. It is an extreme disgust. If you see the microexpression of contempt, whether it's between two peers, two colleagues, with your patient, it is important to pause and address whatever it is that's going on at that moment, whether it's a conversation, a treatment recommendation, whatever it may be. It needs to be addressed right off because contempt, you cannot move past it without resolution right then.
To help you get through that contempt conversation, make sure to watch our video on how to have a difficult conversation. Make sure to start paying attention to the microexpressions that your patients and your colleagues are expressing. Go ahead and take it home too. Leave us a comment because we want to know, what did you learn? Did you like this video? Make sure to like it and share with a friend. And do not forget to subscribe to the Dental MVP so you never miss out.